This week on the BackTable podcast.
You feel like an elephant sitting on your chest. I could say that too. It was just like hard to breathe, hard to move. Going from a seated to a standing up position, I had to literally put my hands on the table or on the desk to pull myself up to stand up. You know, I could feel the pressure when I did force myself on walks, feel the pressure in my hands, feel the pressure all over my body. And I knew something was still very wrong. And I knew it was possibly mechanical. So that was when I reached out to ask Dr. Spencer's office to get me the Doppler ultrasound to be able to figure out what was going on.
And that's what led then to those other two procedures. It's interesting, I guess, because a lot of the venous insufficiency issues a lot of times is kind of like this. There are some people, I mean, Dr. Spencer's much more experienced with it than I am, but there are some people where, you know, it's this instant fix and everything, but other times it takes kind of a little more of this trial and error where you kind of fix one part of it and then you go into that next thing. Hello and welcome to the BackTable podcast, your source for all things interventional and endovascular. I'm your host, Eric Keller, an interventional radiologist in southeastern North Carolina and board member of the Interventional Initiative, a nonprofit devoted to raising awareness and access to minimally invasive image-guided procedures. So today, rather than chatting with someone about performing one of those procedures, we're instead going to be talking to someone who has had one of those procedures about their experience, to ideally raise awareness among the general public about these life-changing options. So today we have Jillian Angeline, who is a long COVID survivor who went from living this active lifestyle to being barely able to walk, actually. After seeing multiple physicians across multiple states, she ultimately found Dr. Brooke Spencer, who is at the MIPS Center in Colorado, who has now performed 3 venous interventions for her and is starting to help her get her life back. She was really kind enough to come on the show and share her story with us. So thank you so much and welcome to the BackTable podcast.
Thank you so much, Dr. Keller. Really appreciate your time and for chatting with you.
Yeah. So what if we dive back then to how this all started then? Because I know this is a long story. So maybe let's go back to the beginning and then we can just work our way through it.
Sure. Right now, I like to say I'm a long COVID survivor. I contracted COVID back in February of 2020. So it's been nearly 5 years of dealing, like you said, with countless doctors across multiple states, from the Northeast to the Southeast to the West Coast, trying to find ways to get better. I can say I've tried Western medicine, Eastern medicine, lots of prayer. But until I found Dr. Spencer, who I call my angel on earth at this point, you know, I didn't really feel like full healing was possible. I knew that there were some mechanical issues. I could tell there were mechanical issues based off the way that I felt my body was behaving. But it wasn't until I spoke with her and I got the MRV, which for many who don't know, or for anyone who doesn't know, it's an MRI of the veins that showed full compression of my left iliac vein, which is the vein that goes to the left leg. And it brings blood back to the heart. And what I can say is that from that time, February 2020, till now, I've been working and doing whatever I can to still try and have an active life. But I got good at pretending like I was okay. I forced myself to go out and work hard and see friends. But inside, I was having mass inflammation. I was uncomfortable, and I would pay for it after the fact. A lot of people call it PEM, post-exertional malaise, where you can push yourself, and then after the fact, you can't get out of bed, or you feel extremely heavy. The heaviness feeling is something that Dr. Spencer knew about, and it was so validating to hear her talk about it and her to understand it. The feeling, for people who don't understand, is it feels like there is a gravitational force that is stronger than anything you can imagine, pulling you to the center of the earth. And it's something that I've felt for nearly 5 years now. And I can say with, joy that, after the stent procedure, the heaviness did start to go away, but it came back over time. And that's why I ended up getting 2 more procedures with her. I was told I'm only 23 days out from those procedures right now, but I was told the heaviness may come back because of that inflammation from everything she did in those 2 procedures in early September. So I can say that, I'm starting to feel a little bit less heavy, but I know that it's going to be a long process to get to full healing. But, to be able to know that, blood flow is restored and the blood is moving the way that it should and certain veins are blocked, I think that's a welcome sign.
Yeah. Well, and even back in the beginning, you'd mentioned when we were talking before getting on this podcast about, there's a lot of misconceptions. A lot of people don't know both about long COVID, but then also its association with these vein problems as well, that it can be invalidating even when you go to talk to different clinicians that they might not be aware of that connection.
Yes, that's absolutely true. And that's something that was extremely frustrating for myself and my family. When I got COVID in February of 2020, it was it just felt like a flu at that point. It wasn't until, the days and months after where the fatigue remained. I had extreme pain in my legs. And by the summer of 2020, I couldn't walk, to the point where I would try and walk and my body would feel like it's going to collapse onto the floor. Or I literally would just have to sit down wherever I was because my legs felt like they just couldn't work. The feeling of being paralyzed from the waist down. And I knew that there was something truly going on. That doctor, this urgent care doctor in Memorial Day 2020 said, "You're fine, it's just anxiety, go do yoga or go sit on the beach." And I knew that that wasn't the problem. And that's the kind of gaslighting that doctors are doing across the nation right now that needs to be fixed and needs to be improved, in my humble opinion. I can also say that Dr. Spencer's protocols are so important. Every little step is important, from the MRVs to the Doppler ultrasounds that she orders. And a lot of doctors don't know how to handle an MRV or how to handle, some of these Dopplers. The Doppler that I got before those 2 surgeries, they did my Doppler when I was sitting down, and I didn't get the accurate results that I needed. So I needed to go to a separate doctor on a separate day, take up extra time from whatever I was doing during that day, whatever I was supposed to be doing, to be able to go and get that done where I was standing up. And I know you've spoken with other doctors about the importance of getting those numbers while people are standing up, because that's truly going to give you the numbers to show that there really are issues. I think she had said that, correct me if I'm wrong, but she had said that a lot of her patients that got 5.0 or higher in some of those ratings were symptomatic. When I first got the Doppler sitting down, those numbers were much lower. And then when I got the one standing up, the numbers were higher. And obviously it went in line with the fact that I was symptomatic.
Yeah. It makes sense. You're like stressing the issue when you're standing up, because then the flow has to go against gravity. And yeah, other than just interventional radiology, I do diagnostic radiology as well. And I see a lot of times, and maybe, I'm a little biased because I'm tuned in to these venous issues, but there's a lot of times where people keep coming to the emergency department for pelvic pain or leg pain or the heaviness, things like that. And it's been there on multiple imaging that's happened each time that they come, but it's just people aren't tuned in necessarily to look for it that way and do the diagnostic imaging in the way to actually get at that and answer that question. And so it's not uncommon that after multiple times of saying there's nothing on the imaging that's wrong, that then you do it the correct way, and then you find out, yes, there is actually something, and there's something you can do about it.
Absolutely. So what Dr. Spencer did, she did the iliac vein stent. It was about a 5-inch stent. I remember seeing a replica of it after I came out of surgery. And then this past time, these 2 operations that I had in early September, I can give you the exact definition because I looked it up. It's the MT stent with IVUS and embolization. And then she also did the radiofrequency ablation of 4 veins in my legs, the greater saphenous vein in the right leg, the PASV, and the SSV. And then she also did an SSV the GSV in my left leg, which was the greater saphenous vein in the left leg. So it was 4 vein ablations.
Let's go through each of those then, those procedures. So did you find Dr. Brooke Spencer yourself, or did someone refer you to her for that the first iliac vein stenting?
So I was seeing Dr. Jordan Vaughn from the fall to winter of 2022 onwards. Dr. Jordan Vaughn is based in Alabama. I had done countless hours of research, most of the time laying in bed or on the couch because I was too sick to move around. From 2020, through for multiple years, trying to figure out what to do. Of course, there's a lot of information out there, especially on Facebook groups and social groups that in the long COVID community, I tried this supplement, I tried that supplement. Everyone talks about all these different things that they think got them back to 100%. There was a random post on a Facebook page that talked about a doctor in Alabama, Dr. Vaughn, that had made some progress with some people. So I did whatever I could. I contacted MedHelp, called the lines, asked to get in to see him. He's doing great work. He's on the front lines as well, along with doctor in South Africa as well, trying to get all of us COVID long haulers better. And I'm so appreciative for people that are working on the front lines and getting all of us back to our lives, back to feeling full health. And so I saw him. I tried triple blood thinner therapy, which was Plavix, Eliquis, and aspirin all at the same time. I went extremely anemic after 2 months of that. I'm only 105 pounds, and it didn't go well with my body. My mom said at one point, I looked so pale. I looked like a cancer patient. You could see the dark circles under my eyes. And I was still working that entire time, traveling for work as well. And I remember walking through an airport at one point, like not being sure how to move one leg to another. And that's because I lost half my blood volume from that. And so that was when I worked with them and, I pulled myself out of that. They said, let's stop the blood thinner therapy. But I tried so many different things with them, and God bless them for trying all of those different options with me. I had ovulation bursts during that time as well because of the blood thinners. And so I give Dr. Vaughn so much credit for working to try and find ways to not just push a patient out, but say, let's keep trying options. So that's when he brought Dr. Spencer to me. And he said, look, I know someone who's doing procedures in Colorado. You should go see her. You should get the MRV and figure out that maybe this is what's causing the problem. So Dr. Vaughn introduced me to Dr. Spencer. That's when I got the MRV. And that's when it showed in that MRI. And I don't like MRIs. Let me just put it that way. My family knows this about me. For some reason,
them either, but
I'm very claustrophobic, and it took a lot of strength to get through that. But I knew that it was going to possibly give me the answers to get better. Dr. Spencer is so busy, but she still took time to see me after that in the months after I got that MRV. And she had a quick cancellation a week after I met with her in early November. And I was able to get in and get that procedure. And so I think that was a beautiful thing. And I'm really appreciative of that.
What was the procedure like that day?
Well, I always say, and I've been saying this about all the procedures, that I'm the one that's just laying on the table. They just knock me out and they have to do the hard work.
Oh, that's good.
But I do remember the intense back pain after the fact. I was given the low dose opioid tramadol to help with the pain. And I think during the in the aftermath of the procedure, I think they did give the prescription fentanyl to help with that pain. My oxygen levels were fairly low when I was coming out of the anesthesia because of the back pain. I was holding my breath. I think it's natural for humans to hold their breath when they have extreme back pain because it helps with the pain. But I remember my mom telling me to breathe next to me because she was with me. And she was saying, no, you have to breathe to get those oxygen levels back up. That back pain remained for a number of days. And I think they said that was normal. So I'm very grateful for being able to use the medicine for pain management in those days after. But I definitely didn't sleep well for a stretch. And, some medicine also messes with your sleep cycle as well. So I just remember kind of being tired, delirious, but knowing that all of that was going to pay off in the end.
Makes sense. So you were kind of asleep. You weren't noticing very much for most of the procedure, but then when you woke up, it's when you had the back pain. And then that back pain and tiredness from the anesthesia lasted a few days, then it sounds like.
Yeah. And I don't remember anything from any of the procedures. In actuality, I was knocked out for all three.
Got it. After you were feeling tired and had the back pain, when did that kind of resolve? And then when did you start feeling better than I guess you were before that procedure?
Well, I have to say, there were moments where I felt less heavy, which was wonderful. But I had a bad reaction to the blood thinners in the aftermath. But as you know, and as many interventional radiologists know, the blood thinners are important to help the body, not reject the stent, since it is a nickel titanium stent. So I had to go on multiple different kinds of blood thinners to try and hopscotch through that period. So I think at one point, I was on 4 baby aspirin at one point because I knew I could tolerate the aspirin. but I was feeling very anemic in that stretch and very tired and heavy. But I think once I got out of that situation, I was able to get to a lower dose of blood thinner, down to like 1 aspirin. That did help, and I did see progress in that stretch. I was forcing myself to walk more, but that was a month or two after the procedure.
So it wasn't like was it a magic bullet, like instantly you were feeling better and the heaviness was gone? It was kind of this slow recovery afterwards as you kind of adjusted to having that vein open.
And I do remember when I spoke with Dr. Spencer back in April, I remember telling her that I was actually feeling like I was doing better. I felt like I was walking more. I could do like 3 or 4, maybe 3 miles walking and force myself to walk. But I still felt very dizzy. I still had a number of issues around certain times of the month. And I just chalked it up to my recovery was going to be slower than most. I remember talking to Dr. Spencer and hearing from her, about other patients that were back to running and doing okay after the stent procedure. And I was like, that just wasn't me. And I couldn't understand why. And that was when I moved here to Texas. And it was in the heat of the summer, 110 degrees every day. And my symptoms got so much worse this past summer. And I really felt like I was going downhill fast. I couldn't sit for long periods of time at my desk to work. I felt like someone was like a 500-pound man was sitting on my legs. And I was having so many, that's the only way I can describe it, Dr. Keller.
No,
I don't know how else to describe it.
I've heard multiple people describe, what you were saying about the weight, like getting pulled towards the center of the earth, but also like elephant sitting on me, or I like the 500-pound man. I'll keep that one in my back pocket.
It was the only way I could think about it. You feel like an elephant sitting on your chest. I could say that too. It was just like hard to breathe, hard to move. Going from a seated to a standing up position, I had to literally put my hands on the table or on the desk to pull myself up to stand up. I could feel the pressure when I did force myself on walks, feel the pressure in my hands, feel the pressure all over my body. And I knew something was still very wrong. And I knew it was possibly mechanical. So that was when I reached out to ask Dr. Spencer's office to get me the Doppler ultrasound to be able to figure out what was going on.
And that's what led then to those other 2 procedures. It's interesting, I guess, because a lot of the venous insufficiency issues a lot of times is kind of like this. There are some people, Dr. Spencer's much more experienced with it than I am, but there are some people where, it's this instant fix and everything, but other times it takes kind of a little more of this trial and error where you kind of fix one part of it and then you go into that next thing, which it sounds like was more of your experience.
And I think there was a possibility. I remember hearing from Dr. Spencer during follow-ups and checkups throughout, after November, that there was a chance that embolization would be needed. And so I think we all knew that it was possible that would be something that had to be done at some point if I didn't improve fully. So I'm really grateful that Dr. Spencer squeezed me in. She's really growing in the practice. A lot of people are hearing about her. A lot of people need this help. And I think a lot of them are COVID long haulers too.
Yeah, she helps a lot of people and is doing fantastic work. And I know she's, training people as well to spread the number of people to do the things that she does. So.
And that's so important. And that's one thing that I really want to stress, that, being able to have someone like Dr. Spencer who can take all of her knowledge and her wealth of expertise and spread it to the next generation of interventional radiologists, to other interventional radiologists across the country, that's what's going to move the needle. Because, I was coming out of the anesthesia, I believe that the second procedure, or maybe it was the first in September, I don't remember. But at one point, my mom said, I turned around to her and said, we have to clone Dr. Spencer.
Maybe she's doing that in ways by training people to be like her and open these centers that are similar to it. It's hard to perfectly clone her.
Oh, I know. But, there are medical options out there.
That's right. So what about the second procedure then? So let's talk about, so you go and see Dr. Spencer again. You went through the heat of summer in Texas, go and see her. Then she suggests is this procedure then, like the embolizing the veins in the pelvis or the gonadal veins, things like that?
That was the first procedure. Did you want to talk about the first one or the second one, the vein ablation? So
we did the stenting one and now the embolization one. What was that one like then? What were you thinking about around that?
Well, I got to say, it was a lot easier than the first one. They said that it would be actually a little bit easier, that one, than the stent procedure. I just remember having a long recovery from the stent procedure. But the embolization, she used a combination of foam and coils to embolize the veins in the abdominal and pelvic regions. She did say that she had to use twice as much foam as she normally does in my situation. I remember when I was still coming out of the anesthesia, she was going in to do another procedure because I was the first procedure of the day. And she does so many now every day and really trying to help so many people, which I think is absolutely wonderful. Yeah. But she was going to put on her like heavy
the
coat
lead?
The lead. Thank you. She was going to put on the lead and she turned around and she goes, "You looked like you had 4 children, the way that your veins were as big as they were." And my mom and I were both saying, "Wait, what does that mean?" And she's like, "I'll explain later." And then she went into the procedure. And so when she came back out, she said, normally a lot of those veins should be very minuscule. You shouldn't be able to see them on imaging. And I've never had a kid in my life. So to be able to see all of those veins so strongly, she sent me those images via airdrop to have them on my phone. You can see the before and after. And then once the foam is in, the impact that it has. And there was a lot of foam in there. A lot of white foam in those pictures. But that was something that, pre-COVID, I was a runner. I could do half marathon. I've done 5Ks, 10Ks, you name it. I did the Army 10 miler in Washington, D.C. I'm a runner. I was in excellent health. I loved working out. I would try workout classes. I haven't been able to do any of that in the last, nearly 5 years. And that makes sense if all of that is from COVID.
I mean, you've been through so much, and I'm glad that you've been able to find the solution. I did want to go back, just for those listening that might not be familiar with kind of the medical side of it, is that veins aren't a high pressure system. So the way that they work is there's these like one-way valves like this, and the blood is kind of pumping up as your muscles kind of flex. It pushes the blood up and it goes through, and that makes them not go back the other way. But what can happen is if you have some sort of blockage like Jillian had, or other things, is those veins become incompetent. The little valves that are supposed to work no longer work, and so the blood can go the wrong direction and pool. And those veins stretch, they get dilated. And so what we're talking about with this is that you can have a lot of veins in your pelvis down there, particularly for women, and they get really dilated, the blood pools there, and it can cause all sorts of symptoms. A lot of times it's this heaviness, this pain that gets worse when you're standing or sitting. It can make it uncomfortable. And so that's what we're talking about, is going in and actually blocking off those veins, because you can safely destroy those veins.
Talk about blockages. It was Dr. Vaughn who had special technology to be able to take my blood and look in a microscope and see clots. And I have those pictures on my phone that showed those clots in my blood. And that was the reason for that blood thinner therapy. That was the reason why he was trying to get rid of all those clots. And he said, if we can get rid of the clots, then you'll get better. So that was something. But, I think that like you said, it's good that we were able to get these procedures done.
Yeah. So what was the recovery like then from the embolization one? So you said it was then easier. When were you starting to feel better? Or how was that?
So that night, I remember I went on a walk around an airport nearby just to get out. All you had to wear were compression leggings, just down to your thigh, which weren't bad at all. They were just comfy leggings, workout leggings you could find online. And I remember feeling a lot better at that point. And that was fantastic. But I only had one rest day in between the first procedure and the second procedure. And I did work remotely that day. So it was great to be able to feel like I had a bit of a normal life in between the two procedures. But I definitely felt better after that. But the second procedure, I was required to wear compression stockings for 12 days after the fact. That's the worst feeling. One of the nurses joked with me and said, "I can't give you narcotics for compression stockings." I'm not a fan of anything tight like that on me. And that was honestly the hardest part of both procedures. Were not the procedures. It was the tight 20 to 30 mmHg, millimeters of mercury compression stockings. That was hard because I had to do overnight after the procedure with the bandages underneath, 4 bandages underneath with the gauze and everything. And then when I was able to pull them off, I still had to wear them 12 hours a day or something to that effect for 12 days after.
And now you're on the other end of it, because when we first met, you and I talked about that a lot, about that usually is the worst part. And I think people don't appreciate it unless you kind of talk about it ahead of time for patients.
Yes. Oh, goodness. And it's funny because I talk with friends about that and they say, oh, I wear compression stockings all the time when I fly or when I drive or whenever. But after a surgery like that, you're still pretty uncomfortable sometimes. So it just adds to the process.
Yeah. And to be wearing it, throughout that much of the day. And then the ones that we give people tend to be a little more aggressive, the ones that you prescribe, rather than the ones that people wear on, say, like an airplane or stuff like that. Not that you can't get the more aggressive ones. I just think a lot of times that people are like, oh, I wear compression stockings all the time. They're talking about a more comfortable compression stocking than what we're talking about that you went through.
Yeah, and I did feel my blood pressure increase when I was wearing the stockings. I did feel there was probably a half hour every time I took them off of my body kind of re-regulating, because they were so tight on me. I could take a pencil and draw every thread line of those stockings that were on my legs. I wanted to follow doctor's orders, and I knew that there was a reason for that request. And it was going to help me in the long run. So I wanted to follow those rules. And I think it's important for patients to do that.
Yeah, it really is important with that one in terms of getting the best results. And to go back for the medical side of this one, the ablation that Jillian was talking about, this third procedure, then it's the same kind of idea, but you're destroying the veins in a different way. And these are superficial veins in the legs that also, same sort of thing, where it's those valves that aren't working well, and they can let the blood pool there, create a lot of discomfort. Sometimes you can see them when people see it, they have varicose veins. You can see them under the skin, and you're using heat, radio frequency heat, to destroy those veins. That's this third procedure that we're talking about. In order to have a good result, then you have to wear these compression stockings that compress your leg, like giving it a big hug if you've never worn them before. But it's not necessarily the most comfortable hug.
I think at one point I may have called them a torture chamber. So,
There. So hug isn't the good analogy then. So.
It's a very tight
strangulation.
Yes. But it was three veins on the right leg and one on the left leg. I was told that I'd feel a cord-like feeling possibly after the fact, hard cord-like feeling under the leg. The right leg, I haven't felt anything like that. The left leg, I feel more of a zing or a zap every now and then if I sit for too long and I go to stand up and I walk around. But I've noticed that has started to resolve itself over the last few days, which is fantastic. And then I do still have a little bit of numbness on the left leg, and I had looked that up and it said that was normal as well for some time.
Yeah, sometimes there are nerves that run right beside it, these superficial ones. So sometimes you can have some numbness. So I guess where are you now then? So you've had these three. Is there would you say that you're 70% better than where you were when you started? Are you 50%? Where are you now after going through all of this?
Well, Dr. Spencer did say not to be surprised that in those 7 to 10 days, which I assume is after the compression stockings come off, where I might feel heavy again, where I might have inflammation. So I do notice that I'm still kind of, as of I think yesterday, that 7 to 10 day stretch is over. But I do notice a little bit of inflammation still from both of those procedures. Like we said, it was a lot done in a short period of time. And I know that, and as I told you this before, I know that this isn't going to be I'm 100% better, wake up, you're good. I know it's going to be a bit of a road to full healing. But I am forcing myself to get up, to walk around, to go on walks. Last night, after a full work day, I did go on a walk. I noticed that when I wake up in the mornings, for the last 5 years, when I would wake up, I'd feel very heavy, and I wouldn't be able to stand up straight when I get out of bed. And I've noticed that I've been able to get up and stand up straight. And I wouldn't be hunched over like an elderly person. I've noticed that I can stand up. I feel my posture better. That's just one little example. I mean, it's a big one in my life, but it's one little example of the progress. The lack of heaviness at times is freeing.
Yeah. I mean, that sounds like it's much, much better than being barely able to walk, or every time that you, pretend and force yourself to kind of put on the face act normal, and then you're paying for it later and everything. That it sounds like that this has really helped, I mean, not that you're out of the woods or that you're 100%, but it seems like this has been a really great solution for you, that you didn't have a lot of options before.
Well, I have to say, I'm a person who loves the heat normally. I was like that pre-COVID. I loved the heat. I loved being outside in the heat. I called that a hug from the atmosphere. And so I loved being out and about. I lived on a Pacific Island for 3 years as for work. And I loved the warmth. And I could not handle the warmth in the last 5 years. And when I was in a hot environment, I'd have the little neck fan, or my body would literally start to physically panic. I could feel the panic inside my body, and I could feel it. It was the inflammation. As I've been told, veins and heat do not play well together. And so I did recently go out to dinner with a couple friends outside. We sat outside and it was hot. And there were moments where I could feel myself going, oh no, like, how's my body going to react? And my body was relatively okay. And that was just a few days ago. So I know that all of this may actually work, which is so incredible to know that I may actually be able to get my life back and be able to do the things that I once loved to do.
The heat back in your life again.
Yeah, that would be just wonderful. So I'm so grateful to interventional radiologists like yourself, like Dr. Spencer. I'm grateful to Dr. Vaughn for introducing me to Dr. Spencer. And, this was not an easy path to get to this kind of answer. But I know that this work and being able to tell my story on a platform like the BackTable podcast is going to help so many people get help. And I think that that's something that's so important. I told you this before, and I knew that once I got 100% better, which I'm not there yet, but I'm getting there. Once I got 100% better, I was going to shout from the rooftop whatever was the solution, because I want people to feel good again. I see on so much social media, so many people are struggling right now with issues, and they may not know that interventional radiology is the answer to their prayers.
Yeah. I really appreciate you coming on to share this story. I think it's when I first met you and we started talking about it, I think we're really blessed to have you on to advocate for other people as well. So maybe in wrapping up, I wonder what your advice would be, I guess, to other people that are where you were almost 5 years ago that are struggling with it. I guess what advice would you have for people then?
Well, go see Dr. Spencer for once, but there's only one of her. So go see interventional radiologists, get the tests that you can. I think it's also important to never give up. I never gave up in this entire process. It was a lot of, well, maybe I'll just, in some ways it's like, okay, maybe I just deal with this now and say this is my life now. No, I don't accept that. I don't want to accept that. I want to be able to get back to where I was before all of this. I want to be able to live my life and not be in excruciating pain every single day. So just never give up. Always look for options. Don't let doctors gaslight you. Know that there are doctors out there who validate you, who understand you, who want to fix you. My mom always said, I was never saying, why me? I was saying, how do we fix me? And it's such a beautiful thing to be able to hear from yourself and Dr. Spencer and Dr. Vaughn and so many others, and hear that there are options to get fixed. So do as much research as you can. See if you have interventional radiologists that have done some of these procedures in your backyard. Get the MR, request an MRV. Do whatever you can to get better, because there's a good life on the other side of all this.
Yeah, it's like you have to be an advocate for yourself,
Absolutely. And I think that's something that, unfortunately, I think there are definitely long COVID groups out there that are helping people. But I think increasing awareness from things like this podcast, but also just going to conferences, meeting with people in communities, traveling from community to community perhaps, and finding those people, reaching out on social media. I mean, I see more and more tweets from people who say, I can't get out of bed. I've kept my window shades down every day. Being able to get the word out to those communities and say, there are answers. There's healing. There's a reason why you're feeling this way, and it's not all in your brain. There's a physical, mechanical reason for why you're feeling this way.
Yeah. I think it's a good message for clinicians on the other side of that relationship too, that I think it's easy sometimes with just how complex and large medicine is that you're in your own little silo and sometimes not willing to collaborate with people in other specialties that might be able to help your patient. I always say medicine's a team sport, and it's hard to be all the players on the team. You really need to, I guess, have the intellectual honesty to say, I've kind of reached the edge of what I can offer this person. Let me see if someone else can help them. And it doesn't make you any less of a physician or clinician or healer or whatever else to do that. It's a complex thing. We should all be on the same team trying to help people like yourself.
And that's why I'm so grateful that Dr. Vaughn introduced me to Dr. Spencer. Like you said, if you have a large group of people talking to each other about their experiences, about what patients are experiencing, and how to get everyone better, that's the goal. That should be the goal in the medical community, being able to help people and get them back to where they should be.
100% agree. Well, thank you again for coming on the show. I think it's just so important that we capture these stories like yours to try and get them out there. And I appreciate all of our listeners. Keep tuning in. We plan to do more of this series of hearing from people that have undergone these procedures. And there's been kind of a common theme so far of this being an advocate for yourself and people, maybe not being aware of some of these options. So having the strength to reach out and find those things. And hopefully this podcast can at least be a little part of that outreach for you. So thanks for tuning in, and we'll see you again next time.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck,
Sabine Dawn,
Michael Barraza,
and Ali Behetti.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manveer Singh Sandhu.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening.